Courtney Boggs.
And I'm Wendy Meeks, and today we're going to be talking about saw palmetto. Saw palmetto is a small palm tree native to eastern United States. It's a fruit that was used medicinally by the Seminole tribe of Florida. Saw palmetto is used traditionally or folk remedy for urinary symptoms associated with an enlarged prostate gland, also called benign prostatic hyperplasia, as well as for chronic pelvic pain, bladder disorders, decreased sex drive, hair loss, hormone uses and imbalances, and prostate cancer. The ripe fruit of the saw palmetto is used in several forms, including ground and dried fruit, or even whole berries. It is available as liquid extracts, tablets, capsules, and as an infusion or a tea. You can typically buy saw palmetto at your local health food store, or you now see it at the big major food chains, as far as grocery store chains, Walmart and Walgreens, or even your local CVS.
The cost of saw palmetto is fairly cheap for most of our patients. They can get it at Walmart, a 100-day supply for $6.98, or even at CVS for $17.99 for a 120-day supply. The typical dosage for saw palmetto is 160 milligrams twice a day, or they can do 300 milligrams just once a day. Saw palmetto works by exhibiting both dihydrotestosterone binding at the androgen receptor and the enzymatic conversion of testosterone to dihydrotestosterone by the 5-alpha reductase. This inhibits DHT binding to cellular and nuclear receptor sites, thereby increasing metabolism and excretion of DHT. This inhibits both cyclooxygenase and 5-lipoxygenase, thereby contributing to its anti-inflammatory and anti-edematous effect. So basically, this mechanism of action has been shown to have spasmolytic activity, and it's been shown to reduce nocturia and to increase urine flow rates by up to 50%.
The adverse effects of taking saw palmetto are relatively mild and even rare. According to Skyscape, the adverse effects are dizziness, constipation, headache, nausea, and diarrhea. There are really no herb-to-drug interactions that were found in any kind of clinical study, and none really described at this time.
What did the study say about saw palmetto? Bent et al. Did a study with 225 men. 112 of them received saw palmetto and 133 received a placebo over a 12-month trial period. During this period, it was found that there were no significant differences in urine flow. This study concluded saw palmetto was no more effective than the placebo, but contraindicating to that, Eisenberg and Kapchuk did a study with 16 randomized double-blinded clinical trials involving 2,939 patients. The results of these studies found saw palmetto to be beneficial in improving nocturia and peak urinary flows. Of these 16 studies reviewed, 2 were compared with finasteride, and the conclusion of those 2 studies suggested similar effectiveness of finasteride in decreasing BPH symptoms. Overall, there were more studies showing improved urinary flow and nocturia, but there are some studies out there stating saw palmetto is ineffective. So the application for our patients, this medication can be suggested to our patients. It is fairly safe with little adverse effects and medication interactions. It is pretty cheap for them, but the best thing to educate patients on is that some studies show that the medication is not effective. Let the patient know that it is an alternative worth the try, and that it can or cannot decrease their BPH.
In closing, it's up to the provider to recommend saw palmetto to those patients for BPH symptoms. I'd like to thank you very much from Wendy Meeks
And Courtney Boggs.
Thank you.
Thanks.